Hello, we are nursing students from the University of St. Joseph. This is an educational presentation about the symptoms, need-to-know knowledge, and what to do in an emergency for asthma and allergies. Does someone in your family have allergies? If so, you might have allergies too. That's because allergies are often hereditary. While allergies are more common in children, they can appear at any age. Sometimes allergies disappear only to return years later. Exposure to allergens when the body's defenses are weak, like after an illness or during pregnancy, can play a role in developing allergies. It's time to take control of your allergies and start enjoying life again. Common allergies include seasonal allergies with pollen, trees or plants, pet allergies from dogs or cats, food allergies from gluten, nuts, shellfish, eggs, milk products, latex products, medications such as penicillin or aspirin, mold, dust mites, and nickel are all common allergies.
Common allergies include runny, stuffy nose, sneezing, skin rashes and hives, nausea, vomiting, wheezing, difficulty breathing, coughing, fatigue, headaches, fever, itchy eyes, and upset stomach.
Testing for allergies. Skin testing. Suspected allergens are pricked into the surface of the skin or injected into the skin. It is done on the back, forearm, or arm. If allergic, there will be a redness and swelling at the site. This procedure usually tests more than one allergen at a time. Positive reactions usually appear within 20 minutes. Sometimes, redness and swelling can occur several hours after skin testing. The delayed reaction usually disappears in 24 to 48 hours, but it should still be reported to the allergy doctor or nurse. Some medications do interfere with skin tests. The allergist will tell you if you have to change your medication before the skin testing. Blood testing. It is used to identify allergies to pollen, mold, dust mites, animals, insect stings, foods, and some medications. An allergy blood test is often used because the patient is taking a medication that can interfere with skin testing but cannot be stopped for a few days. If the patient suffers from a severe skin condition such as eczema or psoriasis, and if testing with a strong allergen that might cause a severe positive reaction, a sample is sent to the lab for testing. Results take at least 1 week. Both types of skin tests have little or pain. However, positive reactions can cause annoying itchy red bumps which look and feel like mosquito bites. The itching and bumps are usually gone in just a few short minutes or hours. Your allergist may apply a cream to your skin to help decrease that reaction or have you take an antihistamine afterwards.
Some educational information that might be useful for you are to read ingredients on your food labels. Let the restaurant or food service staff know of any allergies you or your child may have. Carry an EpiPen with you at all times. Notify the school nurse of any allergies or medications your child is taking. If your child has an allergic reaction, always bring them to the nearest emergency treatment center.
Treatment. There are many medications that can control allergy symptoms. Decongestants and antihistamines are the most common allergy medications. They can help reduce a stuffy nose, runny nose, sneezing, and itching. Other medications work by preventing the release of chemicals that cause the allergic reactions. Corticosteroids are an effective treatment in the inflammation in your nose. An example of a decongestant is Sudafed. Combined decongestant antihistamines would be Benadryl, Claritin D, Zyrtec D, Allegra D. Corticosteroids would include fluticasone or Flonase, budesonide, or Pulmicort. Another treatment is immunotherapy. Immunotherapy can train your body to become less allergic. It is a preventative treatment for allergic reactions to substances such as grass pollen, house dust mites, and bee venom. Immunotherapies work by gradually increasing doses of the substance or allergen to which the person is allergic to. The incremental increases of the allergen causes the immune system to become less sensitive to the substance by causing production of an antibody which reduces the symptoms of allergies when the substance is encountered in the future.
Anaphylactic reaction. Anaphylaxis is a life-threatening allergic reaction in which an over-release of chemicals occurs, putting the person in shock. This is a medical emergency. The airway closes, the person will have trouble breathing, and the person will be wheezing. Commonly, there will be swelling of the face. Anaphylaxis is frequently associated with allergies to food, insect bites, medications, and latex. Treatment includes administering epinephrine and bringing the individual to the nearest emergency facility. Just because a person with allergies has never had an anaphylactic reaction doesn't mean that one can't occur in the future. If you have had an anaphylactic reaction in the past, you are at risk for future reactions.
What is asthma? A chronic condition that causes inflammation and narrowing of the bronchial tubes, the passageways that allow air to enter and leave your lungs. Allergic asthma is triggered by an exposure to an allergen, such as mold or pet dander. Non-allergic asthma is brought on by factors such as stress, exercise, illness, extreme weather, and irritants in the air, and certain medications. Some causes of asthma are family genetics being a key factor, and environmental factors such as exposure to secondhand smoke or air pollution. Asthma is very common. Asthma symptoms affect an estimated 26 million Americans, including 20 million adults and 6 million children. That's approximately 1 in 12 people. Asthma ranks among the most common chronic childhood illnesses, accounting for 13.8 million missed school days a year, as well as more than 14 million lost work days for adults.
Signs of asthma. Regular cough, struggling to catch your breath, whistling or wheezing sounds when breathing, chest tightness, shortness of breath, difficulty breathing. The key with asthma is that symptoms reoccur. Your allergist can evaluate whether your symptoms are signs of asthma.
Common triggers. A trigger is something that provokes a response from your body. In the case of asthma, your body sees these triggers as a threat and releases chemicals to combat them. And these chemicals, in turn, can cause an asthma attack. Different things act as triggers for different people. Common examples of triggers include exercise, illness, allergens, certain medications, weather, stress, smoke, and foods.
How to treat asthma. Keep a rescue inhaler with you wherever you go. Medications to treat asthma include bronchodilators and inhaled corticosteroids. Bronchodilators expand the passageways in the lungs and loosen mucus from the lungs. Bronchodilators are a quick relief. If you have exercise-induced asthma, your allergist may recommend using a bronchodilator before exercising. Inhaled corticosteroids are used to prevent symptoms, asthma attacks, and for long-term control. Consider the rule of twos. If you find that you need your quick relief medication to treat asthma symptoms more than twice a week, or you wake up at night with asthma symptoms 2 or more nights a month, then your asthma is not well controlled. If you refill your quick relief medication more than 2 times per year, that is another sign your asthma isn't well controlled. Allergy immunotherapy is a preventative treatment for allergic reactions to substances such as grass pollens, house dust mites, and bee venom.
What to do for an asthma attack? Utilize rescue inhalers, sit upright, take long deep breaths, and slow breathing. Remove the trigger. Seek emergency medical attention if symptoms persist. Stay calm. When you're having an asthma attack, that is the most important thing to do. Have a plan in place will help you remain calm. This plan should lay out what medications to take during an attack and when to seek medical attention if your symptoms are improving.
There is no cure for asthma, but there are effective treatments available. The best way to manage your asthma is to work with an allergist. Studies shows that people with asthma who see a specialist, such as an allergist, reduce their symptoms, emergency room visits, hospital stays, sick visits to the doctors, missed days from work or school, and healthcare costs.